Hey, everybody. Welcome. Welcome. Thank you for joining. We will wait a minute just as people are filing into our Zoom room here. Welcome aboard. Good to see you all. Thanks for joining. We'll just wait another minute for folks as folks file in here. Welcome. Welcome, everybody. Just waiting another minute as people are filing in. All right. Thank you for unmuting me, Maya. I am delighted to be here. I am Dr. John Kelly of the Recovery Research Institute, and welcome to you all. Thanks for joining for this next episode in our Recovery Science Series webinars. This is actually our 16th installment of our Recovery Science Series. Feel free to check out our prior, if you missed our prior webinars, we have them. I'll show you the link in a second, but we have them on our website. You can view any of our prior webinars in our archive on recoveryanswers.org. But we have a very exciting topic today and a great speaker who I'll introduce in a minute. As always, we start off with a brief informational video about the Opioid Response Network. This series is sponsored by SAMHSA and the Opioid Response Network, as many of you know, and we're doing it under the auspices of that. And of course, this network is designed to empower clinicians around the country to take effective action and help individuals who are suffering from opioid, amphetamine, methamphetamine, and other stimulant use disorders, as well as other kinds of substance use disorders. And Maya's going to play it's just a 1 to 2 minute video just to put you in the picture of what the Opioid Response Network is and does. So take it away, Maya.
Communities across the nation are mobilizing to address opioid and stimulant use and the overdose crisis. You can't overcome this alone, but we can, together, and we are. We are the Opioid Response Network, a coalition of 40 national organizations representing more than 2 million people. We serve all 50 states and 9 territories locally through our network of nearly 1,000 professionals working across prevention, treatment, and recovery. For state agencies, organizations big and small, and individuals working to address local needs, we bring training and education to bear on your efforts. We're here to help you help others through evidence-based support, all at no cost to you. For instance, the Opioid Response Network helped the Tribal College in New Mexico join forces with local organizations to develop a culturally appropriate prevention, treatment, and recovery training series for its students. In Rhode Island, we convened correction staff from 34 states to share how our program had reduced post-incarceration overdose deaths by more than 60% and supported them in their efforts to build similar programs in their home states. In West Virginia, we mobilized to help a clinic incorporate substance use disorder services into their practice, serving a faith-based community. We helped healthcare providers in South Dakota address barriers they face providing treatment services for their patients. We're here to help those on the front lines. So, what are your needs and how can we help? Visit the opioidresponsenetwork.org to learn more and to submit a request for support. The Opioid Response Network, funded by the Substance Abuse and Mental Health Services Administration. Communities.
Great, thanks, Maya. Well, hopefully that kind of gives you a sense of what the Opioid Response Network is and does. The most important thing to remember and to spread the word about is that this support is completely free to you or to clinics and clinicians around the country, or service workers, recovery support service workers around the country. You can go to the opioidresponsenetwork.org and put in a request for technical assistance or consultation. It's completely free. So spread the word. If you want to know how to implement contingency management or another service in your clinical practice, you can get trained on how to do that. You can get trained on recovery support service implementation or other kinds of things that may be of help to you in your practice. So please let folks know. Submit a request yourself. It's completely free to you. Thank you. So next slide, Maya. Yeah, this is just to show you the list of prior webinars that we've had. So we have a broad array of different topics here, as you can see. Feel free to check those out on recoveryanswers.org. And I think it's under the I think it's under the multimedia tab, I believe. So we're going to start off with a brief poll, just to give us a clue of who's here. It's anonymous, but if you can just fill it out, we'd appreciate it. So just take 30 seconds, please, just to click on the choices here that apply, and then hit submit, and then we can move on. You just have to scroll down to get to the other bits. All righty, thank you so much. How are we doing there, Maya, in terms of completion?
Good, we're at about 50%.
50%, or I'll just take another 10 seconds. If you can just fill that out, hit the submit button. Thanks for doing that, really appreciate it. Just gives us a clue of who's here. It is confidential, anonymous. So we appreciate that. And okay, so how are we doing now, Maya?
Good, I just ended it. We're at about 81%, so thank you.
81%, magic, thank you. Yeah. So fantastic. So this tells you who's here, and gives you a breakdown of, if you want to know more about who's attending, please let us know. We can send you these polling results here. But thanks so much. Really appreciate you doing that. And we'll move on. And today's speaker, we're very grateful to Dr. David Eddy, who's here today to give us a talk on recovery coaches, which of course is such an important topic these days in terms of the implementation of recovery support services in clinical settings and emergency rooms, et cetera. Have really been an important innovation, and they're starting to be evaluated, these models of care. And just a little bit about Dr. David Eddy. He is the Associate Director of Clinical Translational Recovery Science at the Recovery Research Institute with us here at the Massachusetts General Hospital in Boston. He's also an assistant professor at Harvard Medical School. He's a clinician working with patients suffering from substance use disorders, and he's a great colleague and an asset to us. We're very grateful to David today for him coming and giving his expertise today. So David, I will pass it over to you, and hopefully we'll have some time at the end for questions.
Thanks so much, John. It's a pleasure to be here. Now, tell me, are you seeing my slides or presenter view?
That's presenter view.
Presenter view?
Yeah.
How about now? Slides?
Yep, that's it. Yeah.
Like going to the optometrist, isn't it? It's a pleasure to be here today, John. Thanks for the introduction. Before we jump in, I just have a few disclosures. I'm the co-founder and partner of Peer Recovery Consultants, and we provide peer recovery support services to the community. I'm also on the Scientific Advisory Board and a stockholder in Vivi Health, which is an addiction recovery support app, and in the world, a virtual reality platform that provides mental health support and care. So what do recovery coaches do? And I'm cognizant of the audience here. You know, some folks are clinicians, some of folks probably actually work in this capacity, and there's scientists as well. So I just really wanted to give a high-level overview of what recovery coaches do, and perhaps more importantly, what they don't do as well, just so we're all on the same page. So these are peer-driven mentoring, education, and support services delivered by people with lived experience of addiction and addiction recovery. And peer recovery supports, including recovery coaches, may have many different goals depending on the context in which they're working, but primarily their main goal is to link people to traditional substance use disorder care and to supplement the care they're getting. And I also think about peer recovery coaches as being really important in helping people transition between levels of care. But I'm going to get into unpack this a little more in the coming slides. SAMHSA came out a few years ago with their working definition, and I wanted to share that for you as well. SAMHSA define peer recovery coaches as a peer helping peer service alliance in which a peer leader in stable recovery provides social support services to a peer who's seeking to help in establishing or maintaining their recovery. So it's really important to know what recovery coaches are or what they don't do. Because when I talk about recovery coaches out there in the world, the first thing most people say is, "Oh, you mean like a sponsor? This is like an AA sponsor, right?" And not really. So it's actually really important to know recovery coaches aren't sponsors, and they don't adhere to any particular therapeutic approach. Right. So now a peer recovery coach may have found recovery through a mutual help program like Alcoholics Anonymous or Narcotics Anonymous, but they don't have a specific allegiance to that approach. So the idea being, if you're a client of a peer recovery coach, they can give you advice or suggestions around other kind of recovery support services. That may include mutual help programs, but they can also talk a little bit about traditional treatments like cognitive behavioral therapy and what that might look like. And they can talk about the recovery resources one can find in the community and help that individual connect with those resources. Now, importantly, recovery coaches are not licensed clinicians. They're not physicians, they're not psychologists, they're not licensed clinical social workers. So they don't diagnose, and they're not providing psychotherapy or treatment per se. Now, a lot of what recovery coaches do, they provide empathic support, which could feel a little bit like supportive psychotherapy in some ways, but they're absolutely not providing psychotherapy. And recovery coaches are being used in a wide range of treatment settings. So hospitals, like at Mass General, for instance, where we work, we were early adopters of peer recovery support services at a lot of different levels of care. So we have recovery coaches, for instance, work in the emergency department. They do phenomenal work. Whenever a patient presents to the ED for any kind of substance use related problem, that could be an opioid overdose, it could be an injury sustained while under the influence of alcohol. Any patient presenting with substance use disorder related problems is going to get a visit from one of our recovery coaches, a bedside visit. And they're really just going to initiate a conversation, non-judgmental. They're going to use some motivational interviewing strategies. They're not going to force care or services on an individual. They're just there to have a conversation about what treatment might look like, what options could be. So one example might be, for somebody with opioid use disorder, recovery coaches might be talking about medications for opioid use disorder as an option, and how the physicians in the ED could help connect that person to a provider who could give them provide them with those medications. It's a really important work, and it's what I think is so notable about the work our recovery coaches do in the ED is their ability to connect with patients. If you are a person with lived experience, particularly opioid use disorder, but other substance use disorders as well, if you've ever been into an ED for a substance use related issue, hopefully you had a good time of it, but you well may not have. These are really stigmatized conditions, and in places like EDs, folks with substance use disorder aren't always treated real well. And so for a lot of folks, there's an inherent distrust of medical staff and medical systems. So, it feels really different when you've got a peer recovery coach sitting with your bedside, talking about their lived experience. They're really walking the talk, and they can talk about treatment options in a way that perhaps folks are a little more likely to hear what they're saying. So recovery coaches are also being used extensively in detox units. And now they have a few roles here. Like typically a detox unit will hold somebody for 2 to 7 days while they're medically withdrawn from alcohol and other drugs. Now it's an opportunity to talk with patients about treatment opportunities for when they leave a detox unit. So recovery coaches can be really helpful in increasing motivation to engage in subsequent care. That could be 28-day treatment programs or even outpatient services if they're appropriate. And the other great thing recovery coaches can do is they can actually physically link a patient from detox to say a 28-day program. They can actually physically go with somebody to an appointment. And these are things that wouldn't really be appropriate for a licensed provider to do. So in this way, recovery coaches can cover some really critical gaps, because we know period immediately after leaving detox, we lose a lot of people there. A lot of people don't make it to the 28-day program, or they just don't agree to engage in subsequent care while they're in detox. So recovery coaches are doing some really important work in detox units. But then also in outpatient clinics, and I wanted to give you an example from my own work at Mass General. So we have an outpatient addiction program called the West End Clinic. It does phenomenal outpatient work. Patients there usually have an individual therapist. They're often engaged in groups as well. So they have a therapist who's leading their groups. And they often have a psychiatrist as well who's managing their medication. So they're getting great wraparound care. And you might think, well, do you really need a recovery coach in that kind of context where people are getting such, extensive care from licensed professionals? Well, absolutely. And they do phenomenal work. Our recovery coaches do phenomenal work. And I wanted to share an example of a patient that I had who was, this is a couple of years ago, he was ambivalent about engaging in treatment. Ambivalent, recognized his substance use was a problem, but really wasn't fully committed to making a change. He was attending individual therapy, and we're mostly working on building his motivation to stay engaged in treatment. At some point, he disappeared from treatment. I was a little worried about him. I suspected he probably had a relapse. I wasn't able to get a hold of him. He wasn't, returning my calls. I was able to get our recovery coach though to call. And he did take the recovery coach's call. He was able to physically go and meet with that person for a coffee and talk about their recovery journey and where they're at. And what had happened, the patient had relapsed and had tremendous shame around the relapse and really couldn't see themselves coming back to treatment. And they had no plan on coming back. And the coach, was able to share their lived experience of recovery and share how difficult it was for them to initially get traction in recovery, in some ways normalizing the experience, but also providing like a really robust role model of somebody who really had succeeded, and was showing living embodiment that change is possible, the recovery is possible. And I think it really instilled that patient with hope. The next day they reached out to me and rescheduled and got an appointment on the books and didn't look back from that point. So, so recovery coaches can do phenomenal work in outpatient clinics, even with folks who are pretty well connected with care. Recovery coaches are being used a lot in recovery community centers, and I'm sure there's been an ORN talk on recovery community centers, or you've heard about these centers. These are what they sound like, the brick and mortar community centers out there in the community that provide recovery support services. And they could include providing space for mutual help meetings, but also employment services and help. A lot of great wraparound support, and also recovery coaching has become an important part of what many recovery community centers offer. And also supportive housing environments like sober homes and group homes for people with substance use disorder and co-occurring mental disorders are increasingly utilizing peer recovery support services in their support models. So, this is not a completely extensive list of all the places you might find a peer recovery coach working, but this is a pretty good representation. You can really see there's been a lot of uptake, in professional systems. Unfortunately, there's not much in the way of peer recovery support services in private practice. So if you're connected with care with an organization like one of these, you can often access recovery coaching. But unfortunately, at this point, it's difficult to find folks in private practice. And I'll speak a little bit next about the certification landscape. And that's really the reason why today most of these support services are found in these kind of established facilities and treatment centers and programs. So this slide's a little bit old. This is courtesy of mass.gov, and it's a slide from the University of Massachusetts. It just sort of gives you a sense of what the certification landscape looks like in the United States. Currently, there's no licensure for recovery coaches in any state, though we may be moving towards that at some point. And this is a relatively new class of service. And I say that, and sometimes people say, well, not really. This recovery coaching has been around for decades, and it has, but it hasn't really been around in a meaningful way until fairly recently. So most states have some kind of certification for recovery coaches, and they use a mix of public and private certification systems. So some states have their own certification that they've created themselves, but some license to private contractors or companies to provide the certification in their state. There's also a lot of job titles used. So, we're talking about recovery coaches here, but peer recovery specialist is commonly used. And I think that's part of the problem is like we're sort of using a mixed language because we haven't really agreed on, how we want to, refer to this class of services yet. So I think that makes for a bit of confusion out in the field. Most states require at least a high school diploma or a GED and the passing of some kind of exam. Interestingly, only about a third of states require lived experience of addiction and addiction recovery. So that means a lot of states do allow for recovery coaching from people without lived experience. Of course, most states have some kind of requirements around training and work experience and supervision as well. So there are quite a few organizations that certify recovery coaches, but these are just some of the big ones. So NADAC and the Massachusetts Board of Substance Abuse Counselor Certification, a couple of the big ones. CCAR out of Connecticut is a recovery coaching certification that's been adopted by a lot of different states. So obviously, two of these are state specific, but other states sometimes adopt a neighboring state's certification just because it's easier than rolling them out themselves. So you can see, like we're looking for at least high school diploma or GED, maybe lived experience, a significant number of hours of training that's often provided asynchronously online through coursework. Then there's usually some kind of degree of direct practice and supervision required in an exam. And just like with licensed professionals, generally there's some continuing education requirements as well. But it really is a patchwork across the United States right now. And you can imagine in the coming years, we'll probably move more to a sort of consensus about, what kind of credentials recovery coaches need to have. But we will probably always have a state-by-state situation in the US. In the same way, licensure for professionals like psychologists is licensed state-by-state and has always been a bit of a patchwork. So I just wanted to draw your attention to this report from SAMHSA. If you're interested in looking up what the requirements are to become a recovery coach in your state, there's this great document. You can just download it as a PDF from the internet. I'm sure we'll share these slides, and you'll be able to, when you have those, you'll be able to just click on that link there, and that'll take you directly to that report if you're interested. So what does the data show say about peer recovery support services? So In last year, we were asked by SAMHSA to produce a report. They wanted to really know about the state of the union, so to speak, or the state of treatment, addiction treatment in the United States. And they wanted to know about recovery community centers. They wanted to know about recovery high school. They also wanted to know about peer recovery support services, recovery coaching. And so they commissioned us to write a report. So we did an extensive literature review and we identified 31 studies. Now, we did a similar report for SAMHSA, I think in 2017 or 2018. And at that time, we identified 11 studies. This is quite remarkable that in just a few years, the literature, the size of the literature on recovery coaching has tripled. And I think, that really speaks to how much interest there is in this. And I think everybody clinically, we all agree there's just tremendous potential. I mean, anybody who's worked with a recovery coach in their treatment setting will know the value they bring. But as is often the case, the science usually comes second. That's slow and you have to be methodical and it takes a long time to put together a study and execute it and write up the results. But there really, I think, is tremendous interest. And we published a review paper that was published in Frontiers in Psychiatry in, I think, 2019 from that first report. And it's been downloaded a lot, it's been cited a lot. So I think there is tremendous interest, I think, at the level, of research, but also clinically and perhaps at the level of government as well. So as of last year, we identified 7 randomized controlled trials. They're really the gold standard in research, where individuals were randomized to either receive the intervention, recovery coaching of some kind, or to a control group where they didn't get recovery coaching. There were 10 comparative trials. So they were essentially multi-group trials, but the groups, they didn't use randomization. And then there were 12 single group studies, prospective studies, where they just followed one cohort of individuals who were receiving recovery coaching over a predetermined period of time. Some of those studies were also retrospective, where the researchers were looking at historical data. They were essentially mining their hospital medical records to better understand the effect of peer recovery coaching in their hospital systems. So one of the things about this literature is it's highly heterogeneous, right? Recovery coaching is not one manualized intervention. Like cognitive behavioral therapy for depression is, one treatment that's manualized, and wherever you're implementing that, it's going to have the same kind of skills and tools embedded in that intervention. Recovery coaching can look like a lot of different things. It can be delivered in a lot of different ways in a lot of different settings, and the literature really reflect that. So, we in the studies we reviewed in this report, we found peer recovery support services being delivered through recovery coaches, but also as peer education services. And even at a very fundamental level, we saw peers delivering skills training. There was a wide range of treatment intensities as well. So some of the interventions were just maybe a single 20-minute conversation a peer was having with somebody about engaging in treatment to try and bolster their motivation to engage with care. But some of these interventions involve peers following peers for 6 months up to 12 months. And there are a wide range of populations studied across these studies. So some populations were engaged in formal treatment, some not. There were studies that included folks with comorbidities, so they had substance use disorder plus some other kind of mental disorder. And there were studies as well on folks who had recently been released from prison. And perhaps in line with the wide variety of kind of environments in which recovery coaches work, a wide variety of research settings were noted, including inpatient detox units, residential and outpatient treatment programs, primary care medical settings as well. I didn't really mention that in my introduction, but certainly at Mass General, our family medicine program includes recovery coaching. And interestingly, a lot of harm reduction programs that are community facing and working out in the community have integrated recovery coaching. So I wanted to give you the results based on outcome. And so obviously not each paper sort of had its own specific set of outcomes, and no one paper reported on all these outcomes. So I've just tried to summarize by outcome type for you. So in terms of substance use outcomes, which you might think, well, that's probably where we're going to start, it was notable that only 13 studies out of the 31 include some kind of substance use outcome. And at first I thought, well, that's a bit odd, given that, the population we're studying, these are folks with substance use disorder. You think they would all be interested in substance use outcomes. But then I thought about it a little more, and well, recovery coaches aren't always focused on the substance use piece. It's often about helping people build recovery capital or connect to resources that are going to contribute to their recovery capital, all those resources that can support addiction recovery. It's helping folks navigate treatment systems. So it's possible that the literature today hasn't, put a huge emphasis on substance use outcomes, perhaps because that's just not the kind of work recovery coaches are doing, or maybe not their focus. Nonetheless, 13 studies, 6 randomized gold standard randomized control trials did include substance use outcomes, and generally the results were positive. There were a few exceptions where there were some negative results, and the effect sizes were modest, so these weren't massive effects. At the same time, a lot of these studies were very brief interventions, so you're actually seeing a significant change in substance use from not too much work, which I think is really exciting. So some studies saw observed reductions in alcohol, others cocaine, and a lot of studies were looking at multi-substance use and saw reductions. Now just one caveat here. I just put this note in about potential for reporting bias. And so what do I mean by that? Well, it's always possible that some studies did measure substance use outcomes, but didn't see positive results, so they did not report the results. That's possible. I'm not saying any of these studies did that, but that's just something we want to always be thinking about when we read the literature. We have to be thoughtful about that. Again, there's no evidence to suggest that in what we saw in our read of the literature, but it's just something to think about. So relatedly, substance use disorder severity, that's a really important outcome to us, certainly in our clinical trials. Substance use obviously tracks with actual substance use, but substance use disorder severity tracks with the symptoms associated with substance use disorder. So in a harm reduction approach, we're actually we're looking to hopefully help somebody reduce their substance use, but they're not necessarily trying to stop, but we absolutely are trying to reduce substance use disorder problem severity. And only 3 studies had related measures, one of them an RCT. So Bernstein, in one of the first randomized controlled trials, Bernstein saw a trend in reduction in addiction severity in individuals receiving brief drug use intervention in a primary medical care setting. So these were folks working with a primary care physician and a recovery coach. Boyd and colleagues the same year saw reductions in physical, interpersonal, and intrapersonal consequences, as well as increases in impulse control and social responsibility in a sample of women living in a rural area. I think it was in Kentucky or Kansas with substance use disorder and HIV. And Crowthers more recently saw increased likelihood of no health-related behavioral and social consequences of drug use following 6 months of peer coaching. So how are recovery coaches doing in terms of helping people link to treatment and engaging in treatment? And I think this is really where recovery coaches can bring a tremendous amount of value. And in fact, that's what the literature shows. 17 of the 31 papers included some kind of outcome of treatment linkage. And so this could have been helping somebody bridge from detox to get to their residential program. It could be an outcome related to continuing engagement in outpatient care. And also quite a few studies looked at medical readmission. They wanted to see if engaging with peer recovery support services would reduce mostly readmissions to emergency departments. And overall, the results have been, largely positive, some mixed, but mostly positive, and very few negative results. So it really does seem recovery coaches can bring a lot of value in helping people link and bridge between levels of care, which historically is where we lose a lot of people from treatment. So recovery capital, and I mentioned this before, but this recovery capital is a term we is increasingly being used in recovery science. And it's really reflects the sum total of resources available to an individual that are going to help them recover. So this could include housing, education, employment. It could be social supports, really anything, tangible or intangible. And so I was a little surprised that there were more papers focusing on accrual of recovery capital. That said, a lot of these papers were following people for a relatively short period of time. So maybe this is less germane. It can take quite some time to accumulate recovery capital in addiction recovery. Now, that said, the results were largely positive. There was one notable exception. Kelly, not John Kelly, it's a different Kelly, found reduced social connections in a peer program for Native Americans living in Montana and Wyoming. But really interesting thing about that study, though, the folks who had less social connection actually had better outcomes on other measures. And so what the researchers thought is perhaps these folks were disconnecting from pro-substance use supports or peers, family, and reorienting to pro-recovery peers and supports. And so in that way, perhaps it was beneficial. Only 4 studies have looked at affective outcomes. And when we're talking about affect here, we're thinking positive and negative affect. In the negative frame, anxiety, symptoms of depression; positive frame, happiness. 3 studies, 4 have reported on negative affect, none on positive affect, which is unfortunate. Hopefully future studies will look at positive affect, because I think that's an important thing that recovery coaches can help folks with. So generally, the results are kind of mixed here. Now, you might argue that recovery coaches are not providing psychotherapy, not really trying to shift negative affect or positive affect. But really, I think we need to be including more measures of affect in our studies of recovery coaching moving forward, so we can better understand if they're having an effect on that front. Only a couple of papers have reported on quality of life. Boisford and colleagues found no change in quality of life from baseline to 9 months in individuals living in a therapeutic community who were receiving recovery coaching. And Ray and colleagues saw some modest improvements from baseline to 6 and 12-month follow-up that were attendant with their recovery coaching intervention, but the results didn't achieve statistical significance. It's just a trend. So where's the literature at? Well, there's a lot to like here. I think there's a lot of positives. There's strong evidence for peer support services on treatment linkage and engagement. There's also really some pretty robust data speaking to the efficacy of peer recovery coaches to support change in substance use behaviors. There's preliminary supportive studies speaking to accrual of recovery resources, recovery capital. So more work is needed there. And we certainly need a lot more research to better understand how recovery coaching might be supporting changes in negative and positive affect and quality of life as well. So I wanted to leave you with the references as well. These are all the studies that I've spoken to today. If you want to look those up, you'll have those. And just a quick shout out before we end about our recovery bulletin from the Recovery Research Institute. We put out a monthly Reader's Digest of 8 important and current recovery articles, recovery science articles. We produce this bulletin that is really, really easy to read and free, and will come to your inbox every month if you just go to recoveryanswers.org and sign up. Thank you so much for having me, and thanks, John, for inviting me to speak today. And we'll have some questions.
Round of applause. Great job, David. Thank you. That was just a really lovely, solid overview, putting us all in the picture regarding the questions you posed right at the outset. What are recovery coaches? What are they not? And what do they do? And where do they work? And how do you get one? And are they any good in terms of the evidence? So thank you for doing that. That was really great, and also in record time. So we've got plenty of time for Q&A. So thanks a million for being very concise as well with it. So that was great. Now, one question that came up, just to kick things off here, we do have about 15 minutes or so, 20 minutes for questions and discussion. So please put your questions in the chat or put your hand up, and we can answer those. But one that came up was interesting one I saw just off the bat, David, which is the difference between peer recovery supports and recovery coaches. And someone was saying, it's not the same thing. Can you explain a little bit about that?
Yeah, they're not. And so peer recovery support services is a very broad umbrella of terms that could capture any number of peer recovery support services. So
or peer recovery support specialist, peer recovery support specialist versus recovery coach. Yeah. What
would you say, John?
Well, I think part of the thing that you mentioned is that there's not standardized terminology, that's used across the board. So in some instances, someone referring to a peer recovery support specialist might be also referring to a recovery coach at the same time. They mean a recovery coach. It depends on where you are and who you're talking to, because we don't have standardized terminology around this yet. So I think you need to inquire what they mean and what their role is, and certification, et cetera, to really get at that. I think that would be my answer.
Yeah, and that's my feeling as well, John. I mean, we, at Mass General, we refer to our peer recovery support specialists as recovery coaches, and we, they work in very much in a clinical capacity. But in other contexts, a specialist might be providing psychoeducation. Their role might actually look quite different. And so I think you're right. I mean, we really need to probably come up with some working definitions so we can all get on the same page, because I think it does create a lot of confusion in the field.
Great. I think Stephen Gaspar had his hand up first, and then we'll go to Tim.
Yeah, excellent. Thank you so much. Wonderful presentation. I'm in Calgary, Alberta, Canada. It's about an hour east of the Canadian Rockies. So just found this fascinating. A couple points and an interesting question I have in terms of the information you provided. So I've been involved with training about 200 recovery coaches or so over the years, including people with no lived experience, PhD level clinicians, police officers, numerous nurses and psychologists as well, and medical doctors. Their intent purposes is not necessarily to become recovery coaches, obviously, but to actually, some have even told us to enhance their own clinical practice, which I thought was interesting.
Yeah, that's wonderful.
Yeah, and so numerous of them actually. And I'm also, I myself have a Master of Science in Public Health as well. We actually have a cohort that we're training right now, which a number of them don't have any direct lived experience through substance use, but maybe recovering from other pieces, other aspects.
Other forms of mental health recovery.
Or physical health or other pieces within that, because we do think the skills themselves can help be transferable to other modalities, including, again, a lot of clinical work, but police officers as well. We've had. That said, one of the biggest challenges I've seen is not the quality of training. There's lots of different training. I'm involved with our own brand of training. There's lots of different types of training. That's fun. The issue becomes is the quality of the coach. Now, what I mean by that is I haven't seen any of your literature say what actually makes a good coach. And never mind the training, but afterwards. And you can say we spend 6 to 12 months, et cetera. So we've been asking ourselves that question, what are the markers that make a good coach? So we do have, and at least we started in Canada, what's called the Seal of Excellence. And the Seal of Excellence essentially is like a demarcation piece, like a Red Seal electrician, where it's a peer. So it's an examination, and it's actually a rigorous examination of peers, meaning peers of recovery coaches, not just people in there, to stipulate that this person themselves has demonstrated all the competencies, all the skills, all the attitudes and knowledge and ethical requirements to be a confident coach. Because here's the big thing that I have, whether I'm in the justice system, and I'm a private recovery coach as well. When I'm in the justice system, 99% of my conversation is what we don't do. And most people think we do all the things that you talked about. So all those particular pieces, but it also comes down, and I've anecdotally been told that most people get frustrated by the level of quality of a recovery. Not the fact that the intervention doesn't work, it's the quality of the coach themselves. So that's not in your information. That's interesting. And I'm curious as to maybe anyone in the audience or yourselves specifically, is there any thoughts on whether or not following what we're trying to do with what we are doing, a seal of excellence, or something that demonstrates that certain recovery coaches have a skill that we think is necessary to lead to more positive outcomes.
I love that. It's almost like board certification. And we've been talking about, perhaps implementing something like that in the US as well. And you raise a great point. I mean, most of these studies, in fact, almost all of them did not actually directly speak to the quality of intervention. Most of these were simple efficacy trials or pilot studies, really just trying to see if there was some kind of treatment or intervention effect. And of course, usually those kinds of moderator mediator studies, they tend to come later once efficacy has been established. So hopefully we'll see more studies that do assess the quality of intervention. Now, some of the studies did, include some qualitative component where they solicited feedback from the participants, and generally it was very favorable. But there weren't really any good concrete measures of intervention quality, unfortunately.
Great question. Yeah, it's something that we've looked. This has been looked at a lot, Steve, and as you may know, in the therapy world, right? In terms of who's a good super shrink, right? Who's the super shrink? What is it about their personality? So it's definitely personality factors here mixed in, as well as there's a therapist and the therapy, and that interaction. But anyway, there's more to be learned there for sure. So thanks, Steve. Go to Tim, and then I think it was Sydney, and then Ken.
Hi, my name is Tim. I don't really have a question as much as I want to just offer an alternative perspective. I'm the executive director of the National Association of Peer Supporters, and I wanted to sort of flag a couple of things that were coming up in the comments as well, and sort of name that I can appreciate the space that we're in and who this audience is and what this space is designed for, and want to just offer an asterisk that a lot of the information being presented here is really peer support through the lens of how clinicians understand it. It's not really how, if the peer workforce was presenting on this, how they would talk about it. And so I really want to highlight that. Again, I can appreciate the space we're in and who's speaking and the intention of this space, but I really want to flag that there are some pieces here that the workforce actually has done a lot of work on or has made critical decisions about for various reasons, such as licensure. We've really resisted licensure and continue to say we don't want it because of the strings that come with it. And so I just want to flag that some of the stuff that's being talked about, like the difference between recovery coaches and a certified peer specialist, it isn't that one of them is supposed to be providing or should be in clinical spaces. They're just different levels of training, and some of the states define it differently. So I just want to flag that sort of some of the services that have been discussed today are things that the peer workforce would actually say we don't do those things. But that maybe clinicians understand peer coaches to be doing in a different way. And so I just want to offer an asterisk and really encourage you all to, of course, walk away with some great information, some great research from here, and also really explore this topic within peer-led, peer-run organizations to really hear what the workforce has to say about these topics. Thanks so much.
Yeah, thank you.
Hey, Tim, if you have any links that you could share, that would be great, or any documents that explicate what you're saying, that would be fantastic. Thank you for the comment.
Thank you.
Okay, let's go to Sydney, then Ken, then Jean-Pierre.
Great, thank you so much. I have so many comments to make, but I will make it brief. I am as well coming from Canada. I am the peer support manager for an organization here called Families for Addiction Recovery. So I do have a son who struggles, so I am a peer supporter. And we are supporting and training the family members who have loved ones with addictions, from 13 to 50-year-olds that are suffering. So it's a huge range. And I think the distinction between, I was the one that made the comment about the difference between recovery coaching and peer support, because if you haven't walked in these shoes, you don't get it. And one of the reasons I'm saying that, I want to back that up, because every mother I talk to is like, oh, thank God, someone that finally understands my perspective. I know myself because I've been in the healthcare system for 30 years. I've done a lot of work in the research, and particularly with caregivers. The research is incredibly skewed, and the advice that we get, even from psychologists and psychiatrists and professionals in this space, is horrendous, and kick them out. And there's still so much personal bias, right, attached to what we are talking about. I have gone in and trained many police detachments. That's part of what we do. Do any of them listen? Oh God, no. No, they don't, because they come from their perspectives. Again, they don't have that peer perspective. And so I think that it's really important to show that huge kind of difference. We make an enormous difference, because when a mother's talking to me about what's going through, I've been through it, and I get the realities of what go on. And there's a bit of a difference between caregivers and those that are suffering, but you can't possibly understand unless you've been there. And it doesn't matter how much training you get, you don't get it.
Yeah, I would.
And then, you know, the one other thing I will say, we know that up to 90% of these people are suffering with a mental illness or a trauma. So understanding that piece, because if we don't deal with what's driving the addiction, the primary illness of mental health, if we're not addressing that at the same time, they're just going to keep cycling through the same thing again and again. Yeah. So that's vital.
Yeah, 100%. And one thing I really wish that the literature spoke to more was, and maybe this is a future direction, is but really trying to understand the value added of having the lived experience piece and what that contributes. And I wonder, can somebody who doesn't have lived experience be trained? I'm sure they could be trained to be a very good recovery coach. But I really do suspect that having that lived experience brings a whole nother layer. There's a sort of inherent trust when it's peer to peer.
Yeah.
And I think we really need to know more about that.
Thank you.
Thanks, Sydney.
Thanks, Sydney. Ken?
Hi, Ken Feldstein. I'm out of Massachusetts. I'm a recovery coach. I'm also a licensed alcohol and drug counselor here in the state. I'm in long-term recovery, as you can see, very dinosaur-like, but I've been working in this space for a number of years. One of the things that jazzes me a little bit is, and Tim touched on this, about the quality of the recovery coaching and the professionalism of the recovery coach. And all I want to say, my sobering comment to that is, listen, there are doctors that are board certified that suck. There are lawyers that suck. There are recovery coaches that suck. There are umpires in the MLB that suck. And they continue to work. Okay. It's easy to, I guess, maintain the stigma when it comes to folks who are, working in the space of, addiction and recovery. We're an easy target, to make negative comments about. And it's just something that jazzes me when I hear it, because it's very much alive still in this work. And just one comment I wanted to make too is I've sat through years and years and years of case reviews and trainings with some of the best, addiction minds, definitely in the state of Massachusetts, at BMC, at MGH, and all that. I have never been through a case review with psychiatrists and doctors and nurses and social workers who haven't mentioned at some point in the review, does the patient have a recovery coach helping them? So the respect that we get from the levels that are way above us is definitely there. But the stigma needs to be, continuously addressed. It just doesn't seem to be getting much easier, but I just wanted to make that comment.
Thanks for sharing, because actually I'm glad you flagged that, because I really wasn't thinking about the quality of care being like different from any other field or profession. I was just imagine, like in anything, there's a continuum of care, but you make a really good point. I think there's a stigma, and perhaps it's because there's such a patchwork of training There's sort of an assumption that there's not going to be some high standard. The reality is standards vary even with board certification. You're absolutely right. Right, in other fields, tremendously. Thanks, Ken.
Okay, thanks, Ken. Yeah, Jean-Pierre?
Hello, good evening. I'm coming from Lebanon, a country in the Middle East. So my question is, I'm working in rehab center in a Nusrat al-Nasheed institution for rehabilitation program for substance use disorder. So it's great to see the difference between a recovery coach and other clinical psychologists. But my question is, who decide? We work together, social worker, ergotherapist, recovery coach, psychiatrist. So who can tell, who can decide it's the work of recovery coach? Stop, it's not yours, clinical psychologist. Be patient, social worker. There are a common tasks to do with any SD, substance use person. So who decide? Who can tell everyone to do his or his proper tasks to let the person in comfortable situation? It's very important to see where the responsibilities of each one. Thank you.
Yeah, that I think is a great question. I'd love, if Tim's still around, I'd love to hear his thoughts about this. And I think there's a lot of, in my experience working closely with a team of recovery coaches, there's not a clear line, but there are certain things that a recovery coach could do that wouldn't really be appropriate for me to do. So, for instance, as a licensed professional, ethically, it wouldn't really be appropriate for me to go and meet somebody for coffee or to help them get to a mutual help meeting if they were nervous about going. But for a recovery coach, absolutely, it would be appropriate for them to go and do that. So I think from my perspective as a clinical psychologist, I kind of know where my lines are, and I know where recovery coaches can be helpful outside of those lines. But I'm curious what other people have to say about that, if we have time.
Thanks, Jean-Pierre. Thanks for joining us from Lebanon. Great to hear from you. Other thoughts, question, comments? We got a couple of minutes.
Is there a role for training in motivational interviewing within the peer recovery training system?
Not a rule per se. I know at Mass General, our recovery coaches get a lot of training in motivational interviewing just because it's a very useful tool for helping resolve ambivalence. And I don't know in terms of like state-by-state certification, how much motivational interviewing is woven through those trainings on average. That would be a great question for Tim if he's around still as well. Or perhaps other coaches on the call. I'd be curious what people's experience has been with that. Very hard skill to learn.
Hi, this is Tim. I am still around. It's definitely a tricky question, and it depends on who you ask. Some people will say like, yes, this is a really integral skill. Other people will say, no, it's not appropriate for coaches or peers to be using because it's more associated with clinical modalities. Where we really struggle is that a lot of the trainings will incorporate sort of motivational interviewing light. And so then there are pieces of it incorporated. And so then the coaches or the peers will say, well, I can do motivational interviewing, and without really recognizing that it's an evidence-based practice. And you all know an evidence-based practice, with certain markers you're supposed to hit that requires a significant amount of training and investment. And so we sometimes end up with people saying, I know how to do MI, when they know the idea of MI, but they haven't done the full scale, intensive, in-depth training to fidelity. And so it really depends on who you ask. I personally would say it doesn't really have a place in coaching or peer support, but others would give you a different answer. So it's sort of, to your point about sort of the fractured state-specific trainings and certifications, it's one of those pieces.
Yeah, thanks for that, Tim.
All right. Well, thank you for the rich questions and comments. Thanks everybody for coming. David, thanks again. We're out of time, but thanks a million for doing this and for helping put us in the picture so well. and concisely. Thanks everybody for joining us this time. We hope to see you next time in the next segment of our Recovery Science webinar series, and we'll see you all along the way. Thanks a million.